Well, 1 in 5 Americans has had COVID-19, according to new data. Daily infection rates are rising in some states, and some medical analysts are expecting another variant of the virus will emerge.
1 in 5 Americans have now had COVID-19. More than 66 million confirmed cases and counting. In reality, says the CDC, it's probably way more, like 4 times more. The Omicron variant is now spreading this virus like never before. Is this the beginning of the end for this pandemic?
It is an open question as to whether or not Omicron is going to be the live virus vaccination that everyone is hoping for, because you have such a great deal of variability with new variants emerging.
There's a good likelihood we're going to see another serious COVID wave of a new variant, TBD, to be determined, that's going to start in the summer.
Infections right now unquestionably falling in parts of the country. Green is good. New York is green.
We are winning. We are winning. And we are going to win.
But not yet. More than 100 patients left waiting for an ICU bed in Oklahoma City Monday morning. Our caregivers are still strong, according to an open letter penned by 4 healthcare bosses in the city, but they are exhausted. Even these heroes can't keep up much longer.
If we have to stop the happy talk about Omicron, this is still a very serious pathogen, especially in light of the fact that so much of our healthcare workforce is getting knocked out at home with COVID.
I had 103-degree fever every night.
Serious pathogen. ESPN's Stephen A. Smith spent New Year's in the hospital with COVID.
And they told me, had I not been vaccinated, I wouldn't be here.
Another massive issue, hundreds of schools remain closed by the Omicron wave.
We have failed our children. Throughout this entire pandemic, we have not prioritized our kids, and now we're seeing the effect.
Researchers just published their review of 36 studies on the impact on kids of such school closures in 2020 in 11 countries, with almost all studies documenting poorer mental health and well-being.